Welcome to Fridays with Dr. Frida, and I'm here with an amazing periodontist. His name is Dr. Terence Jackson. He is from Stamford, Connecticut. Dr. Jackson is both my teacher and my mentor. We work together, and I think you are absolutely inspiring. I would really love for you to teach us today about things that you do in your practice and how you view periodontal diseases together with the immune system, and what exactly you think that the periodontistry affects in the entire body, because everything is super connected, and we want to teach people that the mouth is not just the mouth is part of the entire body, and I think you're the perfect person to do that.
Oh, well, thank you. It's quite an introduction. So, you say that the mouth is part of the body, which is a really funny statement because a lot of doctors don't see it that way. But the reality is the mouth is the beginning of the alimentary canal, right? And it's the second dirtiest place in your entire body. It's where more bacteria
Dirty.
lives. What's that?
I thought it was the first dirtiest place.
No, it's the other end, but you're close. So a lot of what happens in your body actually you can see in the mouth first. A lot of diseases, autoimmune diseases, will show up in the mouth first. So, to be able to take a patient and do a thorough exam and find things that maybe were missed or predetermined what's going on with them, it's kind of a special thing. You get a special relationship and a bond. I had a patient that came in probably, I'd say it was about 15 years ago. And she came in and she had deep pockets, and we were doing an exam, and the tissue just didn't look right. And I said to her, I said, look, you need to go for a blood test. And she said, I already went for one a couple months ago. And I said, yeah. I said, let me try and clean you up a little. But after I cleaned her up, things still didn't heal quite well. And so I said, look, I really feel like a second blood test would be a good idea. And
Smart.
unfortunately, it turns out that she had leukemia. But we were able to determine that and find it in her mouth first, because she'd had a blood test, nothing came back positive, and then after looking at her gums and doing an exam, we found that she was actually positive for leukemia, unfortunately. So.
Yeah, well, that is one of the things that pushed me into natural medicine, because working, especially as a general dentist, that's something that we always look at every aspect of the mouth. And I always felt like it wasn't the full picture. And
Yeah.
that's why I think that natural medicine is really what pulled me. Can you share with us a little bit of what inspired you to go into dentistry and particularly periodontics?
Oh God. So I graduated with a business degree. I was not a great student in high school. Clearly I was able to do things, but I just wasn't inspired by anything. And so I got a business degree. I didn't really enjoy it. And what's that?
That's so different, business
Yeah,
and
no,
dentistry.
I'm not sure it even helped. But after I graduated, I started doing some research in cardiovascular disease, and that it was amazing. I loved it. I would go in and I would start my experiments at 3, 4 o'clock in the morning, and I'd be done by 3 or 4 o'clock in the afternoon. But I enjoyed the sciences a lot. And I got to a point, and actually the lab that I worked with was at Harvard originally, and then it went off to BU. And I went with them, and they said, look, you're doing research, you may as well do a master's degree. So I ended up getting a master's degree in biology, and then it just became a matter of what's next in life. Should I do a PhD? My father's a medical doctor, and he wasn't really happy with what was going on in medicine. The guy that I grew up across the street from was a periodontist. And I tell you, he had a lot of influence on me because he would talk about his job and his patients, and he was so happy every time I saw him. So I decided to try dental school, and one of my good friends was in dental school. And because I'd done 4 years of cardiovascular research, the first year of dental school, I applied for a grant in the graduate school at Tufts, and I was awarded a grant to do research in the summer, and it was in the perio department. And the research that they were doing was it wasn't uncommon to what I had done in cardiovascular. I just fell in love with it. It was the science, It was
Yeah,
the fact that periodontists are more like the internal medicine doctors of dentistry. There's
all
not
right.
it's not just we have a problem, let's fix it. It's we have a problem. Why is the problem occurring? And how do we fix it? And if we fix it, can we make sure that it stays fixed? And we look at the biology of what happens in terms of disease and progression of disease, and try and figure out the best path for fixing that. So it's not just you have a cavity and you drill and you fill the cavity. You have a bacterial influence on the patient's immune system. Does the patient
Mhm.
have diabetes? Does the patient smoke? Is the patient immunocompromised? What things affect how the patient responds to therapy? And that's really what made me fall in love with perio and dentistry.
You are obviously extremely smart and you work a lot with dental students. You teach at Turo. But if you were to explain periodontics to a layman's person that is watching with us in about 2 sentences, how would you describe it?
So periodontal disease is basically it's the patient's immune system which is reacting to the bacteria. And every patient is different. We categorize patients into mild, moderate, and severe susceptibility. So
Yes.
it's your immune system's reaction to the bacteria which causes the problem. So we all have a certain number of let's say we have 300 to 500 species of bacteria in our mouths, okay? And they're in different proportions. It's how my immune system reacts to that bacteria versus how your immune system reacts, right? My immune system may see that bacteria and say, whatever, it doesn't make a difference. Your immune system may see that bacteria and say, hey, we have a real problem. We have to wall off this infection. We have to resorb the bone to get away from it. And as you know, bacteria multiplies like more than rabbits, right? I mean,
Yes.
it's fastidious. And so it's really your immune system's response to the bacteria which causes the bone loss.
Exactly. So whoever's watching this with us, I want you to know that, just because you have periodontal disease doesn't mean you're not a clean person. It doesn't mean sometimes, and I am sure you experience that too, when patients come in with this feeling of shame and embarrassment that they have this disease, their teeth are, shaking or falling out. It doesn't always have to do with, just the flossing and the brushing. Sometimes it really does have to do with your immune system, genetics, all of those things come into play. And your immune system plays a huge role. It's not just your mouth, it's your entire body that's at play with this. And so don't be ashamed if you are struggling with it. Don't let it get worse just because you're afraid to go to the dentist because you have this embarrassment or shame that you're suffering with this disease, and you are scared to go to someone in fear that they're going to think that you're not hygienic, that you have the inability to take care of your teeth properly, right?
Yeah, it's funny you said that. I mean, I actually had a patient in today who, unfortunately, I told her she's going to be losing all of her upper teeth, and it was all periodontal disease. And I said to her, this is definitely not your fault. This is actually, you can blame your parents. It's their genetics. So I'm not sure she felt better, but we're gonna do a all-on case and give her a nice restoration, so she'll be able to function properly. So
Yeah.
there's solutions, thank God. Modern dentistry has come up with solutions. It's just a matter of once you've done the treatment, it's making sure you move forward with that patient and keep an eye on things so they're not breaking down again.
Yeah, of course. So you said that your neighbor, right, was the reason why you went to periodontics, but to dentistry,
Yeah.
period. What actually made your love for the specialty grow? What kind of case? Tell us a little bit about a possible case that you may have had that made your love for it grow even more.
Well, my love for perio really stemmed from the science of the biology behind it. It was when we started studying the disease process and figuring out that, there are things that make it worse or make it better, and there's things that you can do. Patient comes in, they smoke. Okay, well, we all know patients who are susceptible to periodontal disease who smoke lose 6 times more bone. And so now you're starting to counsel them and kind of help them through this whole process. It was really the science. It's the love of the science behind it. It's not just a drill and fill type of practice. It's more of an intellectual thing. And so for me, studying the biology behind it and looking at the interleukins and looking at the rank ligands and all of these things that you guys will never have to think about, thank God, made me happy. It was all of those little things about the molecules. I mean, I end up reading 3 or 4 textbooks a year just to find out what else is going on out there, just because I love it so much. I should be as smart about everything else as I am about dentistry.
So I remember actually coming into your office and you told me you've been there since 6 or 7 a.m. that morning. And I said, well, you don't start seeing your patients till what, 9, 10?
No, about 8:30, yeah.
8:30. So you come in there super early you said to read the textbooks every single morning.
Yeah,
and
I do.
wow, that passion. I mean, the fact that you're still it's been, how many years have you been practicing now?
Oh boy. About 20, 21, 22 years. Doesn't it show? All these wrinkles, wrinkles, and they say that the rings in the tree show the age. I'm thinking the wrinkles show my practice years.
I think you're definitely doing great. So what still excites you about your work today? And what about, I know you're also teaching at Turo. What about teaching at Turo has made you love your profession even more? I know that giving back to students really, really makes you happy. You've told me that before. So
yeah, I mean, look, I love teaching. I love putting together the lectures. I love, having students ask me questions and test me, and it just, the whole thing. It keeps you sharp, right? It keeps you on the front edge, right? Because
when you teach, you learn.
What?
They say when you teach, you learn.
Yeah. Oh, absolutely. Just putting together the lectures, you get to go through all of the cases that you did, and you look at them and you say, I mean, I take pictures for most of the surgeries I do anyway, and I go back and I review them to see if I could do better somewhere. But putting together these lectures, you're looking at these cases and you're critically thinking about it. You're saying, wow, should I have made the flap over there instead of over here? Should I have tacked the bone graft over there? I mean, things like that. Should I have used this type of bone graft versus this type of bone graft? So that kind of thing really, it makes you think, because you can always improve yourself. And that's really why I take the classes I take and read the textbooks I read is because I think we can always be better. For me, teaching is great because I got these new enthusiastic minds that come through, and I get to mold them the way I want. I have to tell them what I think is important, and you see how they respond. And actually, it's funny. I had a surgery yesterday with one of the students who was assisting me. He went from second year to third year, and I was sitting here quizzing him, asking him, how much space do you need between an implant and a tooth? How much space do you need to it? And he answered every question, right? So the anesthesiologist who I was working with looked up at me and said, that's pretty good. And I felt good because, he's walking out of the school with that basic knowledge. And so from there, he'll build and become a good dentist.
Yeah, I absolutely. You said that you just recently took over the directing of the implant dentistry in Turo College, correct?
Yeah, I did. And my close friend Jay Rubin passed away. He was the director and I was the assistant director, which actually I preferred it that way. But after Jay passed away, they asked me to step in. Shoes I will never fill. I'll tell you that. I'll never fill Jay's shoes. He was an absolute legend and an amazing human being. So I'm trying to do my best to live up to his status.
I'm sure he wouldn't want anyone else to, take over.
To be tortured like he was.
I know he really loved you. You guys were a great team.
Yeah.
And I studied under Dr. Rubin, so
yeah.
I know he really was amazing.
Yeah, he is. He was. Yeah.
Can you tell us a little bit?
You asked me what I love now about dentistry, right? Mm-hmm. So for me, my passion is bone grafting, because when the disease process takes away bone, or let's say iatriotic damage from bad dentistry, or um, from a trauma, the patient loses bone, we have to be able to put that bone back to support an implant. And that, to me, is one of the most difficult things we do well, is to try and regrow bone. And essentially what I say is you're almost trying to act like God. You're trying to give the patient back what they've lost. And it is one of the most difficult things to do well. I do a tremendous amount of bone grafting in my office, and thank God most of it goes really well. And occasionally, sometimes it doesn't go well, and you wonder why. It has to do mostly with the patient's immune system, because you graft and you do the same thing over and over. It's not like you're changing the way you do things from one patient to another. Sometimes your flap is different, and sometimes the materials are different, but you basically are approaching the surgery in the same way. And so if the patient doesn't heal well, if they have a compromised immune system, if their blood flow is not good, that's all going to play into how well they respond to the surgery. And so I'm always looking at new ways of improving that. There's some new stuff on the market that we're trying that increases blood flow to a surgical area, and that seems to be working really well. And hyperbaric oxygen, but you need to know about this stuff to be able to apply it, right? And so all this new stuff coming out, and using bone morphogenic protein and GEM21, all of these biologically enhanced proteins that can stimulate bone growth. That to me is amazing stuff.
So can you tell us a little bit about, in a very, very simple way for people to understand, where does bone loss stem from?
I mean, primarily it's periodontal disease, So basically, you have bacteria in your mouth, and your immune system sees it as a threat, and it resorbs the bone around the teeth, right? The bacteria live around the teeth. It's just the sulcus, where the bacteria enter, is around the teeth. So the first sign of problems is going to be inflammation in the gums, and then your body starts to resorb the bone. And so bone loss can be from periodontal disease. Mostly it is. It also can be from trauma. It can be from bad dentistry. It can be genetic. It can be if they have what we call oligodontia, which is undeveloped teeth, right? So there are a number of things that can cause bone loss or result in bone loss, and we have to figure out how to fix that, right? Mm-hmm. I had one of my patients who I treated in my residency program was a 21-year-old male, and he had what we call oligodontia, which is multiple missing teeth. And when a tooth erupts, an adult tooth erupts, it brings bone into place. And so if you don't get your adult teeth erupting, then you don't have that bone there. So I had to figure out how to restore that patient's bone that he never had, and then give him implants, because he didn't want to walk around with a denture. He was a young kid. And it was great. It was an amazing case. It went really well, thank God. And, but to be able to change somebody's life like that, that's the gift. So.
Yes, it really is. I loved working on those cases with you.
Yeah. I mean, we had a few patients together that, because of periodontal disease, they lost their teeth, and we were able to give them back their smile. We were able to give them back their smile. They were able to function as normal human beings. They were able to go out to restaurants without worrying about their teeth falling out when they were smiling or chewing. And, that it's really that ability to give somebody back their life and have them go out in public and not worry about having their teeth fall out that's a gift. It's a special bond that you can develop.
It's life-changing for them.
Yeah, it's true.
So you were talking about the immune system and your gums. Can you tell us a little bit more about the role you're talking about, the interleukins and all of that, how well you know about it? Can you tell us a little bit more about the role that the immune system plays in patients, even though when they're doing everything right? Like what exactly happens?
So that is, I'm going to try and dummy this down for you. That's a
That's hard for you, please.
complicated. It's a complicated question. So basically, what happens is the bacteria which line the pockets, the sulcus, right? You have what's called the sulcus initially, which is probing depth of 2 to 3 millimeters. As that gets deeper, it becomes a pathological pocket where you've lost bone. And so what happens is the deeper the pocket gets, the less oxygen tension there is there. And you get these gram-negative anaerobic bacteria, which live down there. The deeper the pocket, the less oxygen, the worse the bacteria. Now, these bacteria, I'm not going to even go into the names because they're just too complicated, but these bacteria have a product on their surface, on their cell membrane, called lipopolysaccharide, LPS. And LPS, our body sees that and it recognizes it as its poison. And so what happens is once the body, the immune system, so if you have an aggressive immune system, all of a sudden your immune system is going to mount this big response, right? Your body sees this and, white blood cells come in and they release histamine, which bring in more blood cells. And then
Yes.
they bring in macrophages and the whole process starts where you get this big inflammatory reaction and then cells come in to clean up the mess, but they cause bone loss. And I mean, that's really how it starts and propagates.
So you're saying the stronger the immune system is, the more aggressive the immune response is.
It's not necessarily the stronger, but everybody's immune system's different. So your immune system to that bacteria may react very aggressively.
Mm-hmm. Makes sense.
So, and then there are other things which can, make it worse, like smoking and diabetes. If a person has diabetes, then their white blood cells don't work that well. And so, there's going to be, more bacteria, more inflammation. There's not as much smoking is terrible. It causes the the blood vessels to contract, shrink. So you can't get cells in there to clean the mess up as well. And also it makes the white blood cells sluggish. So there are things that, patients do if they have poor oral hygiene, diabetes, they smoke, then it's going to shift that scale from, maybe no bone loss to all of a sudden bone loss.
Mm-hmm. Can you elaborate on that? So I have some patients telling me that when they smoke, they don't bleed. Their
That's
gums
right.
don't bleed. As soon as they stop smoking, their gums bleed. Can you just tell?
Yeah, nicotine is a vasoconstrictor. So it causes those blood vessels to shrink up. And so the more you smoke, the less blood you have flowing through the tissue, right? And you develop very thick fibrotic tissue. And so patients who smoke typically don't bleed that much, which is a bad thing, not a good thing.
Exactly.
Blood is good. It brings nutrients, it brings cells, it takes away the waste, right?
Takes away, of course. It's blood supply is also where you can get those white blood cells to make sure that nothing bad is sitting there, the bacteria.
Yeah.
So
and it brings in, it mounts an immune response. That's where all the cells come from, It mounts an immune response. It sends signals to the other cells to come in and help clean things up. So
whoever is watching this and you're proud that your gums are not bleeding because you're smoking, this is for you to know that even though your gums are not bleeding, it's not a good sign. It doesn't mean your gum tissue is healthy. I get this all the time. I stop smoking and then my gums start to bleed, right? Yeah. So I try to explain this to my clients that that's not a good sign, that just because you're smoking, the bleeding stops. It doesn't mean your gums are healthy. It just means that there's no blood flow.
Yeah.
So
it means you're in trouble.
Yes, exactly.
And if you're susceptible to periodontal disease, you're in real trouble. Because then you're going to have a massive amount of bone loss. So it's funny, actually, I had a patient in my residency. She was a 30-year-old girl, and she smoked a pack and a half a day, and she came in for a consult. And unfortunately, she was losing all of her teeth, upper and lower, because she just had no bone. There was 99% bone loss around her teeth. And And she
30 years
said,
old.
yeah, 30 years old. It's very sad. She said to me, she goes, I knew smoking would kill me one day. I didn't know it was going to make me lose my teeth. So I didn't even know how to respond to that, quite honestly.
Yeah, people are
It's,
just not
it's
warned enough.
heartbreaking. It's heartbreaking. So,
Yeah,
because there's nothing you can do for them.
Smoking affects every single cell in the body. So if you're smoking, just know that you're not doing yourself a favor. Quit
Yeah.
smoking as fast as possible so your body can regenerate, cleanse out your body, and start anew.
Yeah. No, I mean, to your point, smokers have higher implant failures than non-smokers. About 15% more failures in patients having implants who smoke versus who don't. So
Why?
it just affects the bone. I actually, I tend not to do implants or bone grafting or even periodontal surgery in patients who smoke. It's the success rate is so muddled that it almost doesn't make sense.
Right. What would you say the success rate in implants between smokers and somebody with diabetes is? So somebody with diabetes does not heal as well as somebody who's healthy, obviously.
Right. Are you talking about controlled or uncontrolled diabetes? So if a patient comes in and their HbA1c, which is a 3-month marker of control, it's bound hemoglobin. If their HbA1c is, between 6.5 and 7, that's a pre-diabetic, slash diabetic, then they tend to heal just fine. It's
Yes.
if you get the HbA1c, in a patient that has like 10 or 11, then their healing is a little more compromised. But they tend to do okay with implants as well. Uncontrolled diabetes is not necessarily, you may not want to place implants in them, right? But it's not a contraindication. And smoking as well. But I'll tell you, I warranty all my implants for 5 years in my office, and thankfully I have a very low failure rate. But if you smoke, then I will not warranty the implant. It's if you're going to have bad habits and risk that, then I don't feel like I should be responsible for it. So
100%. No, definitely not. So tell me, what do you think about oil pulling?
about what?
Oil pulling.
I don't know much about it, to be honest with you. I know a few of my patients do it. Um,
Do you see results in them?
I haven't seen enough patients to actually tell you whether it's good or bad. It's true. I haven't seen enough results. I mean, I've had 2 or 3 patients that have come in who have done it, and the problem is we put them through phase 1 therapy, which is scaling and root planing to remove all the tartar and calculus from their teeth, and then they start oil pulling. So I'm not sure if they're responding to the scaling and root planing or it's the oil pulling. I'm like, couldn't you have waited to start this, before? So it's funny.
In my humble opinion, the clients that come to me, I always send them to get obviously scaling and root planing. You can't replace that with oil pulling because the calculus, you can't get it out with any kind of oil. It
Yeah.
does have to be taken out with the correct tools by either a periodontist, a hygienist, and so
A dentist as well.
Yes, a dentist. So I definitely do send them for their periodic, cleanings and everything. However, I do see a big difference in them when they combine the two, the oil pulling together. And what I even tell them to do is put a little bit of oregano, like a drop of oregano oil into the oil pulling, into the oil, and to use that. And it really, really helps. So if that's a suggestion you want to start making your practice, I'm sure you're.
Yeah. I mean, look, for me, no matter what happens, if the patient doesn't have good home care after what we've done, after the scaling and replaning or pocket elimination or laser surgery, cleaning these pockets out, if they don't have good home care afterwards, nothing works, right? So I think oil pulling is just another step in saying, look, I care about what's going on with me, and I'm going to do everything I can to make sure that I keep my mouth clean.
Exactly.
I mean,
so that like we as natural doctors, we generally don't like root canals, right?
Yeah.
And what makes you determine whether a client should get an implant over a root canal?
Well, I mean, that's obviously you have to take a look at the x-ray, the surrounding teeth, how much trauma is done to the tooth, right? So if a patient comes in with a front tooth, let me say an implant is not a natural tooth. Okay, it's as close to a natural tooth as we can get, but unfortunately, we have problems with implants as well. It's not, it's not the cure all be all of replacing a tooth. I mean, as successful as we are with implants, you still tend to have a few patients who will come in who have implant failures, right? Or they lose bone around their implants. So
Yes.
I always like to keep a natural tooth if I can, you know. Um, and
That's actually
I think with the new technology, I mean, a lot of endodontists are using lasers, so they're able to get down into these canals a little deeper, and the lasers are able to kill the bacteria right at the apex, which is more successful than with the regular root canal where you just clean it out. But I don't throw away natural teeth. I mean, I make a decision to see what the longevity of the tooth is, how much it's going to cost to fix it, and if we do fix it, what's the prognosis? If we put a patient through a root canal and do a crown, does it only have 6 months? Well, then it's not worth it, right? Then
yeah.
you're better off taking out the tooth and doing an implant, because you don't want to charge them thousands of dollars for a treatment which is not going to last a long time. So I don't think it's as simple as we don't like root canals because we think that the bacteria is down there still. I don't think it's that simple.
Yeah, I actually really loved that about you when we were working together in Connecticut, that you are very honest. I sent you so many of my patients, and you always, because I always wanted your opinion on whether that tooth is salvageable or it's better to be replaced with an implant. And you were always very honest about whether or not that tooth was, good to leave or to take out. And
Except for that one case, which you said the patient needed to have the tooth out, and I said, let's have a consult with an endodontist, and turns out the tooth had to come out.
turned out I was great, like always.
Yep, exactly. So, I don't know everything. That I can tell you.
No, but it's still amazing to have someone like you in my corner, somebody I can, talk to and ask for guidance whenever I need it. You have so many years of experience, so that is really great to have, and I think anybody would appreciate that.
Yeah. Well, thank you. It's I love what I do, so I'm always happy to share.
So
It's part of the
besides me,
teaching.
you've taught so many students. What is the number one principle or habit you try to instill into your future dentists?
Um, I want. That's a good question. I want them just to be present, right? I want them to listen to their patients. Patients will tell you what their problems are, you know, and sometimes we don't listen. Sometimes we think we know better. But the reality is the patients will come in, and I always say that, what happens to that patient that comes in who's complaining about their front tooth and you start talking about all of their other teeth? What happens to that patient? They go down the road to the next dentist who's going to listen to them. And so I think we get caught up in we've gone through so much school and we know this, and we're always right. I think if you listen to your patients and you really sit back, I think you just become a much better doctor.
You have to be in the
Compassion.
dentist there. Yeah.
It's compassion. And I think it's in this day and age, where the insurance is dictating, whether you treat the patient or not treat the patient. I think it's sometimes hard to be objective and to kind of, listen to what the patient has to say. So
I know, unfortunately, I mean, with dentists, a whole other case, but with medical doctors, that is also the issue my clients are having. They, every time I tell them, oh, you need this kind of blood work, they go to their, PCP and they get told that, oh, this is not covered by your insurance, so I can't get this tested. And I say, well, you need that test. It doesn't matter whether it's covered by insurance or not. You need to get it tested.
Yeah.
And there's always that battle of, hey, I can't afford it. Insurance is not covering it. And so I definitely understand what you're saying. And I really feel bad because I think the PCPs don't have a choice. They just have to kind of go by what insurance is covering. Because if they're going to be testing things that insurance is not covering, I think that they can really, find trouble with that, because then their clients or their patients are going to come back and say, hey, you didn't tell me this test was going to cost me $1,200.
Yeah. No, it's true. I mean, look, I'm, my mother, who's 83 years old, her primary care physician said to her, hey, look, we don't do mammograms on 80-year-old ladies anymore. And so my mother ended up with a new provider for whatever reason, who said to her, look, you're a young 80-year-old lady. You should go and have a test and see what's going on. And look, unfortunately, it turned out she had breast cancer, which they were able to treat and remove, thank God. But, if she hadn't gone for that test, she probably wouldn't be around in 5 years. And at 83 years old, she's going to be 88. She's a young 88. So I'm glad she went for the test. But, because doctors, we don't know everything. And unfortunately, we have to remember that we're treating patients, not their bank accounts. And so you make the recommendations and you do the best you can.
Exactly. When clients come to me and I recommend them a protocol and then they start picking out this and picking out that, I say, you know what, I rather not even work with this client, because I know that what I'm recommending is for a reason. And if we're going to start picking out this and picking out that and it's not going to work, then I'm going to look like I don't know what I'm talking about. Right? It's me that's not going to be able to help them. And they're going to come back and tell me that, oh, this is not working. Why did I even spend money on this? So for me, it's so important that I do it as a whole or I don't do it at all.
Yeah, no, I agree. I agree. Look, we make recommendations based on the information that we gather, and we try and come up with the best thing that is going to be good for the patient. So it's, look, it's up to them whether they do it or not. So, but I think the other thing that I want the students to know is they should be accountable. It's, I think being accountable is important, right? Being accountable to the students and to the patients and to the faculty and to the clients. I think it's important, and I think it's something that the new generation is not learning well. I think that they want everything instantaneous, and they want everything without putting effort into it, which is not practical. So.
Yeah, I think the way that students are these days after COVID is really different, right?
Yeah.
You see that trend that changed after COVID and AI.
Absolutely. Yeah. I mean, I'm always arguing with the administration at the school. I want the kids to be in class for lecture. I think that they get more out of it, and they feel like that the students can learn just as much on Zoom, which maybe they can. I don't think so.
Yeah. I mean, listen, being in class and being an active listener, right? Actively answering questions, being there, seeing, the communication, being there with classmates. I don't think anything can change that.
No.
Anything can be better than
No,
that.
it's because I ask questions, I ask questions and I expect answers, and, I don't pick on people. That's not nice, but, you lose something by not being there, by not being accountable. So
are you still doing what Dr. Rubin did and making them read all these articles before class?
I've cut back on the articles a lot because I've cut back on the articles a lot. I think that if I can send the students out knowing the basics, knowing the important facts, I think it's just the beginning of their career and they can build on that. So my goal is to send them out of the school knowing more than most of the general dentists who are out there already. And based on the exams, I think they're going to get that. So
no, it's a great implant dentistry program, Antero. I personally learned so much from there.
Yeah. it's fair. It's not easy, but it's fair. You know, I
Yeah.
expect a lot. So
What still challenges you in your career?
difficult patients, personalities. You know, that's probably the hardest thing that I have to deal with. Is sometimes, when you come up with a treatment plan and the patient doesn't want to do it, it's kind of frustrating, because you're trying to do the best for them and trying to recommend the best treatment for the best outcome. And as look, not everybody, you don't get along with everybody. It's not possible, right? I mean, you're not going to make everybody happy, and not everybody's going to believe you. But getting past that, having a patient decide they don't want to be treated by you, they want to go down the street, that's a tough thing. It's humbling, like, what did I do wrong? Did I wear bad deodorant that day? Whatever it is, it's just, you get over it. You realize that, you're not going to make everybody happy. It's funny. I used to work a lot with this dentist, very good friend of mine now. And she sent this priest in for an implant consult. And for whatever reason, the priest didn't really like me. And he went to an oral surgeon to have his implants placed. And this oral surgeon just absolutely butchered the case. And this dentist called me up.
When they come back to you.
Well, no, the dentist called me up. She had to restore the case. And she was furious with me because the patient didn't like me. And I said, look, I'm not going to get along with every patient. I said, the difference between you and I is you see these patients all the time. They've already established a relationship. I see these patients once in a while. And if they don't like me, they just don't come back. If they don't like you, or if they don't like me, they'll tell you about it. If they don't like you, they just don't go back to you. Right. And the problem was I said, look, if you think all of your patients like you, you're wrong. I have a few of your patients who come in and bitch about you all the time. So it's getting past the point where you have to get to the point where you have a little thicker skin, and you're not going to make everybody happy. And some people are, going to go somewhere else, and that's okay. You can't treat everybody.
Yeah. You got to discipline your disappointment.
Right. Well, I think I can fix everybody. That's the problem.
Yeah. It's very painful to us as doctors, as practitioners, to really, when we come up with a perfect treatment plan and we know it's going to help the person, right?
Yeah.
We know that this is exactly what they need, but they're so stubborn and they can't see what we see. They don't see the vision, and they don't know how that's actually going to help them, especially when money comes into play. The finances are definitely always a big part. And it's very frustrating because in your mind you're like, okay, well, listen, this is just maybe this much, but you're gaining all of this from that. You're struggling, and they're asking you for help, and this is going to help, but they don't get it, and so they move on, and you have to move on with them.
Yeah. No, it's okay. I mean, look, as I said, you can't treat everybody. So look,
I probably encountered more than you. There's so much skepticism. I've been filming.
Look, I mean, honestly, Chinese medicine's been around for thousands and thousands of years, and I think there's more to it than unfortunately, I think the drug companies, because they make so much money, have an influence and impact on how the world is run. And I don't necessarily think that they have all the answers. I think natural medicine plays a big part in it, and actually sometimes works better. It's just because the drug companies don't make money in natural medicine, they're not interested.
Yeah, no, and also because it's healing. When I was in dental school, I remember I was in a class. I don't remember whose class exactly. We were learning about insulin, and we were learning about all of the funding, all this money that was going into insulin research. And I was wondering, I said, why are we putting all this money into researching insulin when we should be putting all this money to, researching about the pancreas and how to fix it?
Right.
Doesn't that make more sense?
So I just read an article recently. There was a patient who was a diabetic. I can't remember. I think it was type 1. but they did stem cell injections into the pancreas, and they were able to cure her diabetes. Like that's where the money should go. Is
It's so painful. Exactly. It's so painful for me when clients come in and they are on 4 or 5 different medications, and I'm sure you see it all the time, and
yeah,
their A1C is still like 11.
yeah.
You
It's
know?
it's the American diet, unfortunately, I hate to say this, the American diet is poison. What we eat is food is medicine. Okay, what we
Yes.
eat affects us dramatically, and so unfortunately, they put so many chemicals and preservatives into the food that we eat that it sends our system into a like a spinning cycle. And so we're trying to fix hypertension and diabetes with medicines that we've created because the medicines the food that we're feeding patients is killing them. So it's like a vicious cycle. I mean, honestly, half the preservatives that we put in food are outlawed in Europe. I mean, doesn't that tell you something? But we're getting off topic a little bit. I
I don't
don't
think
want to bring my own personal beliefs into this.
I don't think I ever shared this with you, but I want to talk to you about it right now. I created this amazing product. See that? It says Dr. Frida on there. See that?
Yeah, I see that.
Are you proud of me?
Yeah. How come you didn't send me a free sample?
I'll send you one.
Wow.
So,
I feel bad.
so this is an amazing product. Okay, it is it's an immuno boost product that is antiviral, antibacterial. If you or anyone in your family feel anything like getting under the weather, or somebody in the family has the flu or COVID or anything, you take this, you are out of bed within a day. If you take this before you even get anything and you're around this person, you will not even get sick.
Oh, please send me some. Every time I go on an airplane, I get sick. Honestly,
Okay.
I get a cold every time I go on an airplane. So
I will.
I'm going to Nashville in a month. So I'm going to take it before I get on the plane. If I don't get sick, you got to stamp
I bring it to you personally.
it. In Stanford. Okay.
I missed the drive. Okay, it's the drive is beautiful. It's so green. I love it, especially now it's summer. Oh my God, it's stunning. So
Yeah.
this product right here, we're going to be putting it into all pharmacies. Tell me your opinion. Do you think this is something that could also be in dental offices?
Yeah,
To
of
out to
course.
Yeah.
Definitely.
Would you give it out to your patients?
I would certainly offer it to them,
Right.
you know,
Yeah. So a lot of my clients
especially if I'm
love
going
it.
to do surgery on them and they come in, they're under the weather, right? Or if they have sinus congestion. I mean,
Yeah.
anything that helps. Look, the worst thing that you could do is do a surgery on a patient who's got a bacterial or a viral infection, because then if things don't go well, you're always wondering, what caused that. And
You know what
so,
we should actually do is I should come to you and teach you what I do to help drain out crazy deep sinus infections,
yeah,
chronic sinus infections. And it's super easy. I'm going to teach you exactly what I do. And you can give that to your clients. Let's say patients, let's say they come in, they're supposed to be coming in about 2, 3 weeks to get the implant. You can give
yeah,
it to them to start, and then they're going to feel better by the time they see you.
yeah, even a sinus lift. Do a ton of sinus lift surgeries, which patients always have. Sometimes they have schmutz in the sinus, so you know
It's
they're reluctant to go on steroids, but that's sometimes the treatment.
if I give you this stuff, you will not have to put them on steroids. I
Yeah.
also have I also have products that will actually make the cysts disappear.
Okay. Yeah, and look, I can track that with the CT scan, so that'd be
Yeah,
great.
I would love to give you that stuff. So,
Yeah.
okay. Last question for you. If you could have every patient understand one thing about gum health and immune health, what exactly would it be?
I think patients have to understand that it's not their fault. I think, if look, if a patient has poor oral hygiene and smokes and they're susceptible, okay, yeah, you're going to lose a lot of bone. But if a patient is doing everything they can to keep their mouth clean, they don't smoke, they're fastidious with their home care, and they still lose bone, I think they need to realize it's not something they're doing wrong, it's something they're fighting against. You know, periodontal disease is a lifelong disease, and unfortunately, if you're very susceptible or moderately susceptible, it's just a struggle that you're going to have to fight every day.
Mm-hmm.
And so I think, I have patients that come in who are guilty. This is the worst mouth you've ever seen. I can't believe I'm let myself get into this condition. I mean, I hear that all the time. And the reality is it's, it's your immune system, and you're fighting a battle that you'll never win. But if you can ward it off as long as possible, then, that's the gift.
Mm-hmm. Yeah, I see that all the time too, not just in dentistry, but in, just health. People allow themselves to deteriorate to the point that, I mean, they don't see the future. They don't see where they're going to end up if they don't take care. If they ignore signs, certain signs that, same thing with, periodontal disease. There are certain signs that come on, right? The bleeding of the gums,
Right.
the teeth start shaking. So similar to that with natural medicine, with what I do, people start having signs like maybe hair loss or the bloating, the fatigue, the brain
Yeah.
fog.
Fatigue. Yeah.
People ignore it until it gets really bad. And then they come see me. And I just wanted to say to everyone who is on who's watching, that don't ignore the signs. Don't ignore signs, because these signs, they're telling you something, and you don't want it to get worse. And same thing with your teeth. You don't want to ignore the signs of periodontal disease. You want to take care of it as soon as possible. Like you said, you are dealing with your immune system, but the immune system is something that you can try to at least help while you have the chance to, instead of it getting worse to the point where you end up losing your teeth, and then somebody like Dr. Jackson has to go in there, pull out all your teeth, bone graft, and restore your full mouth.
Yeah, it's funny actually. I saw a commercial in a magazine, and it was a patient had blood coming out of her eyes, and the caption said, you'd be concerned if you had blood coming out of your eyes. Why wouldn't you be concerned if you have blood coming out of your gums? I thought it was brilliant. I thought it was brilliant, because the truth is your gums shouldn't bleed. Healthy gums don't bleed. So yeah, you're right.
My favorite thing is when patients tell you they floss, but then you really know, right? Because the gums are always bleeding.
Sometimes, yeah. Sometimes.
Yeah. Well, I really appreciate you coming on here. Thank you so much for sharing your wisdom and knowledge with us. The knowledge that you take every single day, about an hour and 30 minutes, 2 hours to learn and to really invest in yourself. Keep doing what you're doing. You're amazing. I really appreciate all your help and mentorship and guidance, and always being there for me, always answering my texts and my calls, and just helping me become a better practitioner.
Yeah, well, you want to become better. That's part of the key, right? So I'll expect you to be dropping off some of that immuno boost soon.
When are you going to Nashville?
August.
Okay.
Yeah.
We'll schedule a time before then to make sure you don't get sick on that plane.
Oh my God. It'll happen. I promise.
You usually take a carry-on, or you give the
No, carry on.
Okay, so I'll bring you a smaller bottle that you can pour it into and take with you.
Yeah, that'd be great.
Okay.
Excellent. Thank you so much.
Thank you so much again.
All right.
See you
Talk to you soon. All right. Bye.